World tomorrow to commemorate the World AIDS Day. This is the day that is set aside for partners globally to unite, renew commitment and show support for people living with HIV and AIDS, as well as remember those who have died from AIDS-related illnesses. Now, we're now joined by our reporter Sada Hassan, who is coming to us live from our city center studio. Sada, good afternoon. Great to see you. We understand that different stakeholders did hold discussions today on striking a way forward, even as you know, COVID-19 threatens to reverse the progress that has been made in the last about 10 years. But damning statistics that we read in our previous report said about 275 young girls getting HIV weekly. Let's take it from there, Sada.
A very good afternoon to you, Grace. Absolutely, those are very, shocking statistics that were revealed today in today's meeting that was held here in Nairobi with different stakeholders being part of it. One of them is LVCT and another one is AIDS Healthcare Foundation. So these statistics are coming in at a time whereby the entire world is marking 16 days of activism against gender-based violence. And one of the key issues that has been put in as a factor that is leading to a high number of adolescents getting HIV and AIDS is gender-based violence. You find that a number of young girls are being raped at an earlier age. So this is one of the factors that is resulting to this huge number of adolescents and young women who are getting HIV infection. Currently, right now in the country, about 1.5 people are living with HIV, and globally it's around 38 million people who are living with HIV. So this is just to show you that still we need to put so much progress in addressing this issue. According to, the stakeholders today in part of their meeting, they mentioned that this is also another pandemic that we are not seeing, or maybe we're not putting so much effort because right now we're focusing on COVID-19, but this is also another huge pandemic that should be addressed properly. You know that also during this time of COVID-19, it has affected a lot of clinical visits, a lot of people who were going to maybe health facilities to get this PrEP. It has also affected a lot of services during this time, and HIV progress is one of them. Putting it at making it to be that the country will go back about 10 times, in the efforts that were put to address this issue. So today was just, to lay front the issues that are there as we prepare to mark World AIDS Day tomorrow. And one of the key things that was also mentioned is the dapivirine ring, which is a new kind of preventative method that will be availed probably in the next 8 to 12 months, because it has to go through a lot of processes, to be accepted and to ensure that it is efficacious to its people. So if it comes here in Kenya, because there are efforts to ensure that once it has been approved by the WHO, right now it has been approved by the European Union, what is remaining is for it to be approved by WHO. So before it gets into the country, it has to go through a certain process by the Pharmacy and Poisons Board to ensure that if this method is accepted here in the country, just like how PrEP is accepted, it has to be ensured that it is effective to its people and that it won't, bring in a lot of side effects. And also, maybe to clarify that how is it effective compared to the rest. So this method is not necessarily going to be used as a standalone. It will be used hand in hand with methods like use of condoms and also all the other contraceptive methods. It can be used alongside with it. Maybe Grace, if you have another question before I move on to mention that, about 50% of the new infections are coming in from adolescents. So it shows you that as a country, we really have a lot to do in terms of addressing the issue of HIV and AIDS here in Kenya.
Right, Sada, I know we still have more to talk about, but let's talk about some of the resolutions that perhaps came from today's meeting by the different stakeholders. What's the way forward?
So, Grace, one of the things that was mentioned is, yes, we are bringing in a new method. We are bringing in an alternative mention to prevent HIV. You know, if someone is at risk of getting HIV, this is an alternative method whereby you can use this ring. It's an intravaginal ring. This is for women, basically. So this is an alternative method. But in order to address the bigger problem, the bigger issue is for us to find ways that we can be able to talk to these young adolescents, we can be able to talk to young women, and also men, because men need to be included into this discussion, because, you know, for any kind of effect to take place properly, you need to involve the larger population. So we need to have better approaches in terms of reaching out to these young adolescents, asking them which method will be, you know, effective in terms of addressing HIV and AIDS here in the country. What are some of the reasons that are, you know, leading to rise of this HIV infections, and addressing those particular issues. So that is just one of the methods that needs to be put forward, and that is also what the stakeholders said. Maybe another thing that was also mentioned was importance of teaching our young people consent. You know, before anything happens, we need to let them understand that you need to say yes or no, especially during this time when we are talking about 16 days of gender-based violence. We need to let our young people, the adolescents, understand when to say no, what it means to say no, and maybe this can be one of the ways of reducing HIV and AIDS infection here in the country. Grace?
In please, just under a minute, we don't have much time, but maybe talk to us about what we can expect tomorrow, being, you know, the official day, the World AIDS Day, in under a minute, Sada.
All right, so tomorrow basically we will be getting a clear picture of how many new infections we have in the country, what are the rates, what is the future progress that the Ministry of Health will be putting forward. One of them that they mentioned today is ensuring that we have youth-friendly services centers in all hospitals. So we will be expecting to hear more of that, because as per the latest, as per 2010 data that we had, it's 7% of youth-friendly services in hospitals. So we are likely to hear if there is an improvement from 2010 until now.
Right, Saad Hassan, thank you so much for that. Our reporter there coming to us live from our City Center studios ahead of tomorrow's commemoration of the World AIDS Day, with damning statistics and revelations there of about 275 young girls getting HIV infections weekly. Really, really unfortunate. Let's move on and cross borders. President-elect Joe Biden has tapped key campaign staff and advisors to lead his all-woman communications team, naming former Obama State Department spokeswoman Jen Psaki as his White House press secretary and campaign spokeswoman Kate Bedingfield as communications director. Senior advisor to the Biden-Harris campaign, Simone Sanders, will be Vice President-elect Kamala Harris' chief spokeswoman, and Biden's former press secretary as Vice President